and welcome to Bitesized Podcast. I am your host, Sandali. Thank you again for joining us here for another snack. Before we dive into today's episode, I wanted to remind you that I am running a giveaway all month, so if you rate and review the podcast, send me a screenshot on Instagram to be entered to win a gift card to the coffee shop of your choice. Bitesized Podcast is here to help you nourish your body and baby, whether you're pregnant, postpartum, or starting solids. If you listened to Friday's long Bracebridge dinner about first trimester nutrients, you will have heard a bit about vitamin D. Some of this might be a bit of a repeat to you, but we're diving a little bit deeper into this important first trimester nutrient. I wanted to dedicate an episode to vitamin D because it's actually a global health problem during pregnancy. The average of vitamin D deficiency is about 50%, but this can depend on many factors. These factors include skin tone, exposure to the sun, latitude of where you live, and a few other things, including wearing sunscreen. Those with darker skin tones are more likely to be deficient by almost up to 6 times. So what is vitamin D? Vitamin D is a fat-soluble vitamin. Fat-soluble means that when you are consuming vitamin D, you require a fat source to help the body absorb it. A great fat source would be MCT oil or coconut oil. Keep this in mind when we discuss about supplementing a little bit later. As I mentioned on Friday's episode, the mother's vitamin D status will determine the baby's vitamin D status at birth. The benefits for baby are proper bone and teeth health as well as immune function. It also protects against respiratory infections and can cut premature birth by half. For the mother, vitamin D status not only affects her immune function, but can affect phosphorus and calcium levels in the blood, as well as affect placental development. Now we know the benefits of vitamin D, but I also wanted to share some risks of deficiency with you. Now, I don't share the risks of vitamin D deficiency to scare you, but rather I just want to empower you with more knowledge to make better choices throughout your pregnancy when it comes to your nutrition. Risks for the baby include low birth weight, asthma, low language development, bone fragility, and an increased risk of type 1 diabetes, as well as an incidence of autoimmune disease. For a mom, risks from deficiency include increased risk of miscarriage, preeclampsia, gestational diabetes, schizophrenia, and multiple sclerosis. Again, I don't mean to add stress to your life, but rather to empower you with the knowledge to make good choices. So how do you know you're deficient? Great question. Even with vitamin D deficiency being a global health problem, it's not routinely tested. So ask your doctor, midwife, whoever you are with throughout your pregnancy, to test it about 2 to 3 times throughout pregnancy. I asked to test it multiple times because vitamin D status can change throughout. These changes can take place because of sun exposure or the fetal needs. If you're like me and you live in Canada, you might have wonderful vitamin D status throughout summer when we actually experience a lot of sunshine, green grass. It's not just igloos and polar bears. However, come Blue Monday in January, it can be quite frigid. We have very short daylight hours, and so our vitamin D status is likely a lot lower during the winter. Now, ideally, if you're asking your doctor to test you, they'll likely communicate your results to you. If this is not the case, I want to empower you to check them yourself as well. Depending on the lab, you're looking between 30 nanograms per milliliter or 75 nanomoles per liter. These are good numbers, and if you're in there, not to worry. So once you know your results, you might be considering supplements. Nutrient requirements will vary from person to person. As I mentioned, sun exposure, skin tone, latitude of where you live can all affect your status. If we're looking to maintain adequate blood levels of vitamin D, we want to aim for between 2,000 and 4,000 international units. If you are living in a more northern climate, this could even exceed 4,000 international units. So if you're some of my Canadian girlies up in the territories, I'm very sorry for you. As I mentioned earlier, vitamin D is a fat-soluble vitamin. This is important to consider when supplementing because when you're looking for your source, you're going to want to make sure that it's in a fat carrier. This could be MCT oil or coconut oil. These are likely things you're cooking with, which is a good indicator of a good supplement. You do not want a pressed pill or a powder-filled capsule. Supplementing is recommended for most people, but especially for those on plant-based diets. It is inexpensive and effective. Vitamin D does not have a large concern with over-supplementing or having it in excess, so there's no need to worry about that. Many prenatals don't contain the adequate amount of vitamin D, so it's important to consider. When looking at Needed, the supplement I most frequently recommend, they actually contain 4,000 international units, when we compare this to Ritual at about 2,000 international units or Care of at about 1,000 international units, it seems like a greater option. This is a great place to remind you that I do have a code with needed. It is Bitesized for 20% off of your order. Consuming your vitamin D supplement with a well-balanced meal, which would include a fat source, will ensure that the body is able to utilize it properly. You may also want to consider looking for a liquid form of vitamin D if that's something you would prefer. The other thing to note is that many of these supplements come from vitamin D3, which comes from animal sources. Again, if you're on a plant-based diet, this is something to consider. Plant-based sources contain vitamin D2. As I mentioned on Friday, this would include mushrooms, and I don't mean the psychedelic kind. For vitamin D3, the food sources are going to be cod liver, fish, salmon, snapper. Just think lots of fishy items. Again, if you're plant-based, you're not going to be able to reach your vitamin D requirements, so supplementing is crucial. So there you have it, folks, vitamin D. I hope that episode helps you a little bit with this sunshine vitamin. My goal is always to help you feel empowered in your nutrition choices for your body and your baby. Again, leave us a review, rate the podcast wherever you listen, send me a DM with a screenshot so that you can enter to win a gift card to the coffee shop of your choice. The Instagram is at bitesized.podcast, and you can check out the show notes for any other platform you'd like to follow us on. And in case no one has told you today, you do look radishing. Bye! Although I am a certified holistic nutrition consultant, I am not your consultant. The information herein is purely for entertainment and educational purposes only and does not always apply to your specific needs. While I strive to provide you the most up-to-date information about nutrition, this is not a substitute for professional and medical advice, and you should definitely speak to your personal healthcare practitioner for advice tailored to you.